Hello, welcome back. I'm Dr. Jim Bailey. This is the second video in our series discussing color blindness and the Good-Lite HRR color vision test. In this video, I'll be discussing how we use that test to determine whether or not a patient is colorblind. Now, the first thing to do before we begin is to ensure that the test distance, the distance from the patient's eyes to the book, is 30 inches. And secondly, that the lighting is of good quality. The illumination on the test book is good quality. And normally in everyday office settings, the overhead fluorescent lights are quite adequate. And we just need to make sure the level of lighting is such that the patient could read print comfortably. So we can open the book, show them plate 1. This is a demonstration plate. We ask them what they see, and we ask them to point or tell us where what they see is, where it's located. And if you notice, the page is divided kind of into 4 parts: upper left, upper right, lower left, and lower right. The symbols or shapes that they're going to report seeing are in those various locations, and they just need to tell us where. So notice that in this first one we have a circle in the upper left and we have an X in the lower right. Now we can proceed to plate 2, repeating the same thing. Ask them what they see and where they're located. Should be an X upper left and a triangle upper right. Now continue on to 3 and 4, stopping briefly after we reach plate 4 and reviewing the results with the patient. And chief among those is that they should have seen 3 different symbols: a circle, an X, and a triangle. And secondly, that there was one page that was blank, that there wasn't any symbols present, and that's a perfectly okay response. Now we are ready to proceed with the plates 5 through 10. And before doing so, we want to make sure we've got a copy of the score sheet at the end of the book handy. We're going to enter our results on that score sheet. So we show them plate 5, again ask them what they see, and record the results on the score sheet in the upper left corner opposite number 5. You'll see a little box up there divided into 4 corners, and we place the symbols in those spaces as reported by the patient. If they get them all correct, we put a check next to that box. Now we continue on until we reach plate 10, allowing approximately 3 seconds between plates. That's just as a rule of thumb. Maybe count to 5 and then turn the page and then record the results. Once we reach page 10, we again pause briefly and review the results. If there are no errors, not even a single error, we can say that the patient's color vision is normal. If any errors are made, even a single symbol missed, then we must continue on to plates number 11 through 24. And we proceed in the same way as we did for plates 5 through 10. Now refer to the upper right part of the score sheet. You'll notice a number 11 there and 2 symbols next to it. And we can record with a check mark if they got those symbols correct. If they didn't, we just leave that space blank. And we proceed on to plate number 24 in this manner. Now, if none of those plates were missed, the patient may still have a color vision deficiency. But if any were missed, then for sure they have deficient color vision. Now, if there were no misses at all, we need to go back and repeat plates 5 through 10 where they had 1 or more misses earlier, and repeat those by presenting them in random fashion. And secondly, it's recommended that we tilt the book either 90 or 180 degrees just to present the test symbols in different corners than they were previously. And if there are now no errors, no repeat of the errors they made previously, we can conclude that their color vision is normal. And if they still make errors, then we'll need to proceed to use all of the test results for some kind of quantitative diagnosis. That would be taking a look at how they performed on all of the plates, numbers 5 through 24. And I'll be discussing that in a little more detail in our next video. Thanks for watching, and be well.